A warning today if you are struggling with a serious health concern and you don't feel very motivated to seek treatment in the pandemic.
Yeah, a lot of people going through this right now. Medical reporter Liz Bonus shares how this shutdown is harming our health in ways that we aren't really hearing much about.
Hey guys, hello to you. Those who care for patients with complex medical conditions are sharing this warning today. They say when you take away incentives such as the wedding to walk someone down the aisle, the graduation to attend where you need to be well enough to travel, or many other life events, it takes something away. These healthcare providers want all of us to know that these things we're taking away may be critical to healing and good health.
How you doing, buddy?
Good.
I tell you what, Liz,
Hello.
when I grow up, I want to be like him.
For months, we had the privilege of following Terry Donoghue's journey back to good health after a diagnosis of Parkinson's disease. He had a surgery known as deep brain stimulation and went from having tremors like this to this after that surgery.
Yeah, Terry is relatively typical of what we see in Parkinson's patients after DBS surgery, with improvements in tremor, dyskinesias, speed of movement, and decrease in medication use.
But Dr. Mark Orlando, a specialist in physical medicine and rehabilitation, told me the shutdowns in this COVID-19 pandemic have changed a lot of motivations for patients to have treatments needed, especially for those who have complex movement problems such as Parkinson's disease.
The burden on someone's life that has Parkinson's is probably higher than almost anything else, higher than a new diagnosis of AIDS, higher than the diagnosis of osteoarthritis of your knee, higher than spinal stenosis and multiple other conditions that we see and treat.
He says add that to not being able right now to easily access care you need to keep moving and events that you're missing, and it's a setup for a coronavirus crisis of a different kind.
It's interesting, we see people that come back, and usually I'm used to good stories every 3 months or every 6 months. Or someone tells me, I'm about to go have my grandson's wedding and I want to dance at that wedding. I haven't danced in 2 years, can you get me there? Or people say, I just need to walk down the aisle, or I need to go to the graduation. People are coming in now, they don't have that to work for. So we've really lost some of the incentives that previously were driving our patients, and that has a detrimental effect as well.
Now, if you're feeling some of these concerns that Dr. Orlando mentioned, talk to your own healthcare provider about what you do need to move forward. Or better yet, if you can, see if there isn't something you can plan that will help you see the future of good health, even if right now it has to be a long way off. I'm medical reporter Liz Bonus. We'll throw it back to you.